I've been in withdrawal for 6 years. It has dangerously deregulated my nervous, immune and hormonal systems.
Maëlle was just 9 years old when she was first prescribed anxiety medication to treat panic attacks. Now 26, she's trying to break a 17-year dependency, documenting the process on social media to find the support she says the medical system lacks.
People are finding each other online to share their stories about coming off benzodiazepines. They're getting the kind of support there that they just can't find with a psychiatrist. Too often, doctors prescribe withdrawal plans that are totally wrong. They try to get us to stop too fast, and it leads to severe symptoms like seizures or even cardiac arrest. We feel completely abandoned by a medical system that refuses to listen to what we're going through.
Fed up with the side effects, Maëlle tried to quit cold turkey in 2020, but it almost killed her.
I'm not doing well. I just got back from hospital and all I do is sleep.
For Maëlle, it was proof that many doctors are highly effective at prescribing Xanax or Valium, but have no protocol for how to stop them. With no official roadmap in France, she follows the Ashton Manual, a globally recognized protocol. It consists of reducing the dose a tiny fraction at a time.
I dissolve my pills and I use a syringe to draw my dose. I have to make these tiny micro reductions of 0.01 milliliters. My adrenal glands don't produce enough cortisol, the wakefulness hormone, which is vital. Without it, you could fall into a coma. If I drop my dose even a tiny bit, I could literally die.
For Maëlle, the toll is severe. She spends most days confined to her home, unable to work because of chronic exhaustion and withdrawal symptoms. But once a month, she makes a short trip to her local pharmacy. It's her lifeline.
Bonjour, je viens chercher mon Lysanxia.
Oui. Alors, vous avez votre ordonnance, madame, monsieur?
At this pharmacy, 1 in 5 customers are here for anxiety medication. France is among the world's highest consumers of these drugs, dispensing over 115 million boxes every year. Unlike antidepressants, which are used for long-term mood stability, benzodiazepines are only meant for short-term crises of no more than 3 months. They're a quick fix that, for millions of French people, has turned into a years-long trap.
Patients don't always realize they're going to become dependent on this kind of medication. They think they'll be able to get off them in a month, but that's just not the case. Sometimes doctors don't help the situation, and they actually increase the dosage. These poor patients get caught in a downward spiral. It can turn into a total nightmare, and it doesn't matter how old you are. It can happen to children, but we see it a lot with the elderly as well.
To find a way out, some head here. This is the only thermal centre in France with a specialised withdrawal programme, partially reimbursed by the state. After 4 years on the drugs, Guillaume finally broke free last year. He's now back to ensure he doesn't relapse.
I tried to quit twice over several months, but I failed both times. I just ended up back on them. It was only after doing the program here at Sojon that things changed. Within 4 months, I was able to cut 80% of my medication, and by 6 months, I was off completely.
The treatment, which costs hundreds of euros, combines thermal relaxation with medical supervision. But even for a success story like Guillaume, the road to recovery is still far from over.
My sleep is still too fragmented. It's not linear, so it's not completely restorative yet.
Leading the team here is Dr. Olivia Dubois. Every year, he oversees the treatment of over 4,000 patients.
Stopping this medication overnight is unthinkable. It's a recipe for disaster. The withdrawal symptoms look exactly like the original anxiety: panic, sleep issues, irritability. It can trick you into thinking it's just a new anxiety attack starting.
Patients also attend workshops designed to help them understand their dependency. These group sessions allow them to share strategies and find proof that recovery is possible.
In psychiatry, we know that the bond between patients is a real asset. Those who are doing better help pull up those who are struggling. and that phenomenon is incredibly valuable.
For Guillaume, that shared understanding was the turning point, stripping away the stigma and proving he wasn't alone in his struggle.
You realize that there are actually so many people dealing with these same issues, asking the same questions I was. I wouldn't say I'm cured, but I've managed to get off the treatment. I'm able to do things again that I couldn't before, like sports, for example. Things are looking up.
While centres like this offer a path to recovery, they remain a small refuge against a massive tide. France's reliance on benzodiazepines fuels a domestic market now worth over 420 million euros per year, a figure that's on the rise.